Yesterday, as I said, Sierra Leone joined the rest of the world to commemorate World AIDS Day on the theme, Take the Right Path, My Health, My Right. UNAIDS says in 2023 alone, an estimated 39.9 million people worldwide were living with HIV. In Sierra Leone, UNAIDS adults and children living with HIV are 77,000, with 70,000 children of the age 15 and from 13 of age 19. While in 2024 there are 3,500 new infections and 2,300 related deaths across, all ages. However, UNAIDS says ending HIV and AIDS at 2030 requires that we reach and engage everyone who is living with HIV, who is at risk for affected by HIV, especially including people who have been mostly excluded and marginalized in the country. So this morning, to chat the way forward about the fight against HIV in Sierra Leone, we've been joined by Dr. Sulaiman Lakoh, who is Director, Disease Prevention and Control, Ministry of Health. Good morning and welcome.
Good morning, listeners, and good morning, my brothers and sisters from AYB television.
Indeed. Statistics are quite horrific, if you ask me. What has the ministry been doing?
Well, generally, I want to first re-echo what you said, that we have 77,247 people living with HIV. In Sierra Leone, and of these we can say about 8% of them are children. Wow. So this is a huge number because when you among adults who are between the age of 15 to 49 years, it's 1.7%. This was not the case in 2000 when we had our first demographic health survey for 0.9. In 2013, it increased to 1.5. And then when we had our most recent demographic health survey in 2019, it's 1.7. So it means a lot. It means that as a ministry, we had then the opportunity or the platform to put intervention, to develop a strategy. That is what we have been able to do. As you mentioned in the preamble, we have a strategic plan that provides a direction that defines our interventions in line with the global HIV response vision, which says we should maintain zero HIV new infections. We should maintain zero death, as well as zero stigma and discrimination. So that platform is what we have been building our strategies on, in line with global targets, to say we should be able to reach 95% of all people living with HIV by 2025, to make sure that they take medications, to make sure that of those numbers, they are doing well with the treatment. Also to reflect on the fact that at global level, we have a target to end HIV epidemic by 2030 as a major public health problem. So we reflect on all those ones, put some key interventions in place to make sure that we address this problem. The figure that you gave earlier to say we have less than 30,000 people on treatment in 2020, we have now seen significant improvement on that. Currently, we have over 73,000 of the 77,000 people that are receiving medication who are now on treatment. It's all because of the strategies that we are putting together to address this problem. And we are robust with those strategies. We evaluate, we bring innovations into the response, and this is where we are getting onto. We are saying for now, based on the numbers we have on treatment, we are at 97% of the total population living with HIV. Of the 77,000, we are talking about 75,000 people living with HIV who are on treatment, based on our data as of June 2024. Our strategies continue to be centered around people, around communities. The strategies to address the problem of HIV involves strong community engagement to make sure that the people understand about HIV. The people embrace those people that are living with HIV. The people go for the services that they are needed, because the services are there for the people. We expand on services so that they can be accessible. We take services to the communities so that people can access them without due cost. So these are some of the strategies that we have been putting together.
I'd like to hold you there for a minute and beg to come in, because as you rightfully mentioned, I'm sure many of us are aware that, you know, HIV is not only contacted through sexual transmitted diseases. Maybe, for instance, I happen to go to the salon, or, you know, I have a haircut done and things like that, you know. But one of the major challenges that people who do live with HIV face is the stigma. I mean, what has the ministry been doing so far in terms of, you know, minimizing that, or trying to see how best, you know, those people living with HIV are being accepted within their community, and looking at also in terms of sensitization, you know, within community level and policy level?
So the strategy is holistic. Part of it is what we are doing to talk to people to know about HIV. And we are happy the media is also involved in this, because the message has to go. And we appreciate that communities are also involved in this. We have a big problem. We have people that are marginalized, people that are in hiding, who have a high burden of HIV. And we felt if we don't address the problems surrounding access to services by that population, it becomes an issue. So one of the interventions that we have been working on together with our partners is to see that we engage law enforcement agencies as well as lawmakers, I mean the parliamentarians. The Parliamentary Committee on Health has been very active, working with the HIV response to see that we address the gap in human rights barriers. But also, our engagement has been very robust with the judiciary, with members of the police, to see that, yes, we remove the barriers around access to services for those marginalized groups who have a high burden of HIV, so they can access services, and we keep them safe, keep also the population that they interact with very safe. So this is one of the key interventions that we have been doing. Now we have set up what they call a Human Rights Technical Working Group, which brings together the Human Rights Commission of Sierra Leone, but also other key partners to lead in the process of human rights for those people that are marginalized, that are in deprived settings, so they can access services. Recently, we did what they call a stigma survey, working with the community people to understand what is happening around the areas of stigma, so we can strengthen education of health workers. We want people to access services, and when they access services, they need to feel comfortable. Nobody talks about them. But we do agree there is still a challenge, and one of our approach moving forward as a strategy is that we need a holistic approach to addressing stigma. We engage communities at different levels. The paramount chief, so they can be champions of HIV. Every community stakeholders, those in the local councils, at all levels, so they can be champions for HIV. But now, people that are listening to me also have to reflect on this, that the people living with HIV, or the people that are at risk of having HIV, are humans. They are our relatives. They are our families. What is critical is for us to embrace them rather than talking about them negatively. Oftentimes, people do that when they themselves don't know about their HIV status. HIV is not a disease that kills any longer. Now, people living with HIV can survive years without any challenge. And there is a considerable improvement when you look at it in terms of the HIV response globally as well as nationally. we talk about what's called U equals U. Untransmittable is equals to undetected is equals to untransmittable. If you are taking your medication, you are doing well. You don't spread HIV. However, you have to make sure you take your medication and you do well. So it means that casual contact and sometimes even sexual contacts is not a dangerous way for people to say, oh, I should not be with someone with HIV. Let us embrace them. We can drink together with people living with HIV. We sit together. We sleep together. We do everything in common together. No amount of employment screening should result in removing people living with HIV from that opportunity, because they have the ability. You are missing the vital component of the society who are critical. So for those with organizations and companies, we want to encourage you. So in short, it's a holistic approach. It is not just the ministry. It is not just the partners in the HIV response, but it is you, it is me, it is everyone that will say HIV is no longer a problem, and we should make sure we embrace everybody, so everybody will feel like I belong to a society. Thank you.
There hasn't been much talk about HIV, you know. To date, I know there have been several activities in the background, you know. For instance, even NAS now, you do not get to hear from them often, the National, you know, AIDS Secretariat. It's been a long while. And so perhaps this is one of the reasons why people are a bit complacent, you know. Perhaps even people feel that HIV is eradicated. They feel it's no longer, you know, among us in Sierra Leone. It's just like for all the other kinds of diseases that have been coming and going. People do not feel the sense of awareness, you know, against HIV. In what ways have you been ensuring that the publicity or public engagement about HIV come alive, you know, in contemporary society, especially now when we do not hear much from you guys? If we've not celebrated, you know, World Day, you wouldn't have been here in the first place.
So one of the reports that you just aired was actually not done as a result of World AIDS Day.
Yeah, I understand.
The report on an assessment that was done by community members. As you can see, people with HIV are there, bringing partners from the district, different community members and actors around HIV. So I believe we are not quiet, and we will not remain quiet, because contrary to the view that people are saying HIV is not in our midst, it is in our midst. And because it is in our midst, we will not remain quiet. We are in communities. We are talking to those people that we believe are very much relevant. You know, there is also an evolution in terms of how messages are being delivered. Before, we just go everywhere, but now we do targeted message delivery. Of course, this goes everywhere, this message that we are passing, people to know that yes, HIV is there, but also want to pass on the message to you, while at the same time, we are able to test to know your status, and put you on medication as appropriate. So those are some of the interventions that we are providing to different community actors. But I want to say that we are not quiet, and we have members every day doing community outreach. Now we have what they call community health workers who are linking communities with the health facilities to make sure that the health facilities have services. We have people that we call mentor mothers. These are also people that link communities with pregnant population, telling us that we are always with the community, talking about HIV, addressing issues related to HIV. So many community actors, those working under the TB component as TB champions in deprived communities. We have people that we call expert clients, who at community level call them peer educators, who are also living with HIV, but linking the community as well as health facilities.
I do not mean to interject, but let's just paint a context, you know, for a while. So being quiet in this instance would mean absence, you know, on social media particularly. You see, these days the dynamics have changed. We're now living through what we call convergence. Convergence, in a sense, for those who study media, means everything in one: sound, pictures, videos, and the likes. Now, the best ways to engage particularly young people is on social media. And I tell you that NAS, not least the Ministry of Health, have been completely absent from, let's say, TikTok, for instance.
So I agree that we have to use new interventions as they are moving forward, and I take that particular correction, the suggestion that you made. But just to also say, even at that level, we are also not quiet. Thank you for bringing that. Maybe we just need to be more robust in using the social media platforms so we can pass the message to different people. When you pass a particular message in social media, there is tendency that you may reach over 2 million people at a particular time. So we take that as a suggestion. But critically, I also want to say that every day, every time beyond World AIDS Day, we are engaging the society for them to reflect on HIV. But regardless of whether you see us or not, as a person in this country, as an individual, your health should be the primary responsibility of you. And HIV is there, it's among populations, and therefore it is good for you to take the precautions that are needed. It is good for you to prevent yourself from HIV. But not just HIV, other diseases that may also have the potential to spread in the same way as HIV spreads. Because if it is not HIV, it could be other diseases. So this is why that bit is very critical. Protect yourself from having sex indiscriminately without use of condoms regularly and consistently.
Lakoh, I'd love to start off with your two last words, population and precaution. Now, looking at the statistics, I mean, the amount of people living with HIV in Sierra Leone, I mean, it's pretty scary, one would say. Let's come to the aspect of access to medication, the antiretroviral therapy. I mean, it's very much important for viral suppression. How accessible are these medications to not just people within Freetown, but also in the rural communities?
So HIV services are available everywhere, not just the medication, but comprehensive HIV services are available everywhere. And as I mentioned earlier on, not just at facility level, but also at community level. At facility level, there is hardly a chiefdom in this country without HIV services. I don't think there is any chiefdom without HIV services in this country. So meaning that wherever you are, you can access a health facility and you should be able to access HIV services. Not just the treatment, but testing, prevention, interventions, all those ones are there. So services are available. We modify also in terms of service delivery. Now we are coming with interventions we call differentiated services that centers the patient. So if you don't even want to go to a facility, we have modalities for services to reach you. We are in, oh, I want to do an HIV test. Yeah, but I'm in this particular community. People move there, making sure that you do the test based on your needs. So some of the strategic shifts, innovations that are coming in to reflect on the needs of the society. I have a patient who cannot afford to collect her medication from Monday to Friday because she is a maid. She only opts for my work at 7 p.m. So she goes to work 7 to 7 p.m. So it's difficult for her. We cater for those population who can go and access services at time when they are convenient. Working populations, those populations that are moving, migrant population. So looking at the population dynamics. So it's about who, where, when, are you going to get these services? That's the approach that we are bringing in.
On that note, permit me to ask now, how fully involved is the ministry getting a particular set of people? I mean, one will say we're not only supposed to concentrate on those set of people, but looking at, you know, the things surrounding them. I mean, people like, for instance, sex workers, men who don't sleep with men, and adolescents, you know, things like that. How fully involved are those people in terms to ensure that they are well informed about having protected sex and not spreading HIV if need be at all?
Our focus is not just the general population. Of course, we observe the fact that we have signed to the universal health coverage to make sure we reach everyone, regardless of the status, regardless of where you are. So we reach everyone with our services. But one of our primary focus is on those populations. We call them key populations. Female sex workers, as they are saying, men who have sex with men, whom some people call homosexuals. People who inject drugs. Those populations, we see them as prime population for our interventions. And we are working with different community organizations, civil society organizations, that provide services for those ones on a daily basis. Some, in fact, we can say they are what we call key population-led, in the sense, I am in that category. I am a man who has sex with men, and I am leading an organization to support my constituency, to make sure that those people have the services, they are rich. So they themselves are capacitated to provide their services. It is not even a health worker like me, Dr. Lakoh, but a lay service provider providing their services, outreach, through various modalities. Sometimes you see people go what they call the moonlight, go out where these people are in action at night to meet them, talk to them, provide the services that are needed for those populations, including prevention services. So that population that you are talking are very critical. We do have a greater challenge around adolescents. But of course, you can also see that they are among this population that we are talking about. So every approach is, we are coming with different interventions to reach those people. Sometimes we provide those who are eligible, provide them drugs that we are talking about, pre-exposure prophylaxis, medications that will protect them from having HIV. And now we have even gotten those that are injectable, which you can give every 2 months. So give you medication for 2 months, they are protected from acquiring HIV. Yes, we are not just providing single-phase interventions, but we provide what we call combination prevention. We don't want to leave you just because we have taken care of HIV. We allow you to have sex without condom. But we do also provide you the opportunity to also sex with condom regularly and consistently. But beyond this, we provide them with other resources that are needed. For example, a man who has sex with men. It is very difficult for those people, you know, when they have sex, because of the nature of the anatomy, the area where that happens. So provide them with lubricant, so the area can be well organized to allow someone to go without causing bruises. So we have so many of those interventions. Even now, sexually transmitted infections, infections that they acquire beyond HIV, beyond hepatitis, we provide resources, medication, so those people can receive those treatments and they are okay. I believe if you interact with them, you know that yes, we are providing the services, and we have what we call drop-in centers. These are not health facilities. These are facilities that are in communities where these people can go and access services. We don't just stop in those locations, but we move away from those locations to meet them in their respective community at different times. At night, during moonlight, during the day. And we are happy intermittently if you want to join the team that do that. You can join us to say, come and see how we reach out these people, not just in the day, but at night. Now this tells you we take care of every member of the society. Now we have developed a comprehensive package of services for those populations that looks at not just those that I have highlighted, the HIV issue, but also sexual and gender-based violence. How can we provide counseling? How can we bring other partners to address this issue if this person undergoes a GBV-related event?
Doctor, another thing that I would like to discuss is willingness to get tested. You see, there's a general, apathy among a lot of people, for going for testing for HIV. It is difficult. It is almost impossible for a fully functional man or woman to just get up one morning and say, let me go for testing. How do we make HIV testing more attractive? Hasn't it gotten to a point where perhaps health workers should start visiting people at their homes, to do testing, for instance? Because getting them to go to these hospitals and healthcare centers could be difficult, don't you think? Yes. Which could be even more confidential, by the way, visiting them in their homes, their private places.
I agree that self-stigma is very high. This is not even the stigma enacted by someone else. But stigma, they go and test me. If I go to a hospital, they will tell me I have something. That's general population characteristics. But the point I'm making here is that we are doing our best and will continue to do our best until we are able to address this as a major problem. We have interventions that we are providing. Now we say self-testing. In the sense, you can get your own test kit, do your test for yourself, and then just communicate that I have done my test, and my HIV test is negative. This is doable. Kits that use saliva, which you don't even need to prick yourself. Kits that also you can prick yourself. So depending on what you want.
Are these kits everywhere?
These kits are available, and we want the population to use them. We are bringing some novelty around this in terms of also getting what they call social marketing. We are not selling this for profit, but we also want, if you wish, to go to a nearby pharmacy and say, do you have an HIV kit that I can test for myself? And then what you need is to provide reports. And it is likely that you'll be negative. So it's about us, the mind. And this is where we want to encourage everyone listening to us today. Today is a day to raise awareness, to reflect on our intervention. Take up the decision to make your life healthy.
Doctor, I don't understand. The picture is a bit fuzzy. You mean someone can just get up and go to any pharmacy, buy the kits, go back to their house and test themselves?
Now, I'm saying the future. Now you can go to a health facility, say, I don't want to test here, but I want you to give me the kits so I can test myself. That's what they call what? Self-testing. This is what we want people to do. And if we have that demand, we will strengthen that particular bit. So you take the decision. You are there. Nobody is there. You are only there. And as I mentioned, our approach to provide differentiated services is getting robust. In the sense, we don't need everybody to come to facilities all the time. If you are sick, we address your problem. But even in uptake of medication, you can get them wherever you want. Some people are not interested. They don't want people to come to their house. That is fine. So we'll give you every option that you can get your medication in a particular location. You can get your drug where you are convenient. Or someone can pick them. You can form a group of people living with HIV. You know yourself. You have one who will say, I am fine. Give me transport. We'll give them transport. Say, I'll pick your medication for yourself. And when I go to you, I can go there as a friend. Nobody knows that I'm giving you this medication. So what remains now is us, the people. The people have to take decision to access these services. They are there. And we have to move to access these services. You also continue to help us as you are doing now to pass on this information that you can test for HIV without the presence of anyone. And if you don't want to get, some people are afraid of blood, for example, or I don't want to see my blood. But you can get your saliva. That should not be a problem. So you can use those particular tests to test yourself. What we need from you is just reports. But we are using this to address the gap. But beyond this, we have different community approaches that we are doing. Family testing, going to different locations to look for high risk. We cannot be able to say everybody, and that's why we are getting different modalities to make sure that people access services. So you can go to a health facility if you want, very closer. Here, as I'm sitting here, for example, if I want to do an HIV test, I will not walk more than 10 minutes. I will reach a facility where they will do an HIV test for me. I can go to Connaught here, which is very close. I can go to private facilities. For example, one facility here that's called Satos Clinic is providing HIV. We want to strengthen all those bits, just at Pademba Road. So meaning, I can go and sit in any community, and I can tell you that here, from here to where you can get HIV services, is not up to 10 minutes. What now remains is us to move and get those services. Get up, go and get these services for yourself, for your well-being, and for healthy life.
Getting those services, I mean, one of the key preventive measures one might possibly say is the use of condom, which is a very important tool, you know. For some people, it's quite expensive. Yes. How accessible is it in terms of affordability and same also in the aspect of access to get condoms?
We have different modalities as far as condom deployment is concerned. At the level of the government, we don't sell condom. We give you condom for free. But want people to sex with condom, not just the 33% regularly use condom. Condom has been shown to be an effective preventive intervention for prevention of HIV and other sexually transmitted infection. This is vital. Leave HIV alone. Talk about those infections that disturb you.
Is it safe to use?
It's safe. Condom is safe. It is very difficult for you to see someone that will say, oh, this condom is allergic. I'm having some itching when I'm using it. They are very, very few, if they are. I've not seen one. So meaning condom is safe, is the most appropriate way, and must be used consistently at all times. No sooner you have sex without an unusual partner. So those are the approaches. Now, we also have the social marketing part of condom, which Care International is handling. Of course, it's a critical bit to also provide that opportunity for people. It's not all the time we are talking about free. But beyond the HIV cycle, when you go to the reproductive health, you know, go to facilities in Cambia, facilities in Port Loko, people are not using condom because of, you know, culture, because they see condom as something that will stigmatize them. Everybody is very tied to sex in this world. And therefore, sex should not be a barrier that will make us to be afraid. And with this, we are also bringing innovations around how we can access these condoms. For example, you go to some of our clinics, there are dispensaries. So you can go and get condom at night. Because condom, na babu meat. Babu meat we left on a corner, people in the intern. But no sooner you left them, say, I can't take babu meat. People are not a goodie. That's how condom is. So at night, people go and collect those condoms. Some people collect those condoms to go and sell. The reality is that if you don't want to buy from them, because my own principle is that if they are using it, that is fine. If you don't want to buy, come, pick from us. It's free. You go to any health facility, say, I need condom, you will get it. And it is less than 10 minutes for you to reach a health facility to get condom that will even last you for 2 months. Condom that can last you for 3 months. So you see,
Doctor,
if we value our health, if we value our quality of life, we should be able to access those services.
As we round off, there's something I would like, we are discussing now, condoms, you know. so the argument a lot of people have been putting up is the experience. For instance, a lot of people feel, you know, using condom reduces, you know, the experience with sex, you know, that softness, you know, that one experiences. Yes. So they feel that without, how should I explain it? I'm not a doctor, actually, I'm struggling a little bit, but a lot of people feel that using condom blocks, you know, that, what should I say? That soft, well, that soft experience you get, you know. Yes, the natural lubricant, you know, not experiencing that is not sex. You know, people feel that abstinence from the bodily fluid, for instance, you know.
It becomes very dry.
Yes, they feel that's not much experience, actually. And so a lot of people do not want to use these condoms. They feel using them will reduce or take away the natural experience with sex. What are your views around
It's psychology. It's the mind. The fact is, we are putting on cloth. And we are putting on cloth based on how our mind feels like. So that's the same way. Condom is a cloth for the private part of an individual during sex. So, if you make up your mind to say, I need cloth, I just don't want to stay like this, so I can protect myself from the sun. I can protect myself from any external factor. You can't do that. But let me just say this. Sierra Leoneans that are listening to me, it is critical you protect yourself. The protection goes beyond HIV when you use condom. Unwanted pregnancies. You protect yourself when you use condom, consistently at all times. You protect yourself from sexually transmitted infections, which might result you in having an offensive, become an offensive in that particular area where you should not be. Your private part will become offensive, with sometimes some conditions that are not palatable to you at all. So the benefits are enormous and outweigh any psychological thoughts around not saying, oh, I don't have direct bodily contact and I need that. Please use it, protect yourself. Right. But if you cannot, find a partner that you know the partner's HIV status and be consistent with that partner at all times. So there is always an opportunity. There is always a way out to this.
Right.
Or you abstain if you can. Focus on just the partner that you have. So all that provides that opportunity for you as an individual to take a decision for yourself. Take action today.
Quickly, in just a few seconds as we wrap up, what message would you give out to young people and basically communities in order for them to be fully aware of these preventive measures and take the necessary precautions?
My
in
message.
Just a few seconds, yeah.
HIV is real. HIV is in our midst. Access to facilities is available right across the country. Go for an HIV test. If you have HIV, take your medication. Adhere to what the health workers tell you. Embrace everyone with HIV because they are humans. They have similar capacity to what you have. HIV is treatable. It's a chronic manageable condition, and you can live for as long as you can if you take care of your health in other locations. Okay,
we'll definitely not let you go without reading some of our messages from our online viewers. Now, Mystic Dwazak says, your data sounds scary. I think more awareness should be done, especially at the community level. Secondly, stigma is another challenge. Even the victims don't have confidence as a result of the stigma.
Yes, access to HIV medication is a challenge, especially in the provincial areas. Some chiefdoms are highly isolated as a result of the topography. Your team should do more on the area of access to HIV medication and awareness raising.
And from Tommy, he says, thank you, Dr. Lakoh, could you please speak about the level of confidentiality as an ethical issue among health workers? This, in my opinion, is a concern if we want a positive health-seeking behavior from the public.
Theo Brimer is saying people are afraid to take the HIV test in society.
And John says the best way we can protect ourselves is to be faithful with our partners. Those are a few of the messages we can take. Maybe,
Doctor,
yeah, quickly, in just
a
minute you can respond.
So the data, I can't say it's scary. We are proud of what we have been able to do. If you have 77,000 people that are living with the disease, based on the estimate that we have from UNAIDS and from the data on DHIS to 2019, DHIS 2019. This can tell you that we have been able to put over 73,000 of this number on treatment. And as long as you are taking your medication, you are fine. You are doing well. What this information should now do is to make sure that those that are remaining, they go for their HIV test. They take their medication. Access to services, as I mentioned, our approach to take multimodal approach is there. Health facilities, communities, please go and get those services. It's very critical. Stigma is supposed to be a responsibility for everyone. Even myself, there are people at some point that we are stigmatizing coming to me. Those patients that are living with HIV say, oh, when they see us together, they will think that you are treating me for HIV. But that's not the case. That's self-stigma. So work on yourself for those people that are listening on this one. The issue of confidentiality, I can assure you, the health workforce is doing as much as possible. This thinking around that if I go to a health facility, someone will disclose my HIV status is where we have the gap. Don't think about that. The health workers are highly professional and they are providing the services that are needed to you at your best interest. Your status will not disclose to anyone without your knowledge. And as a result, go to health facility. Despite this, we are strengthening this bit. We are looking at different models of reducing stigma at health facilities in a more holistic way. Those are the approaches that we are going to do, community engagement. But for those listening to me today, my message here is don't feel stigmatized and don't go for HIV test because of that. Go for a HIV test. If you have HIV, take your medication. Positive living. Nothing happens to you. You can be anyone in this society. You can be any person and you can do anything. HIV will not stop you. Thank you for listening to me. Thank you.
Thank you very much, Doctor.
Thank you.
Though doctors seem to be saying that we should not be, afraid of the statistics,
yeah,
but 77,000.
Yeah,
I did a bit of maths, Doc.
Yes.
You're saying that the statistics are not as bad as people are thinking, but I feel from what I calculated here, 77,000 of 8.7 million people. That's like 0.89% or close to 1%. Yeah.
So how we did this prevalence? We are always looking at population between 15 and 49, and our prevalence is 1.7%.
Okay.
The issues are that we don't want any one person to have HIV.
Okay.
As far as we are concerned, we don't want any single individual to have HIV. What we want is for this society to remain HIV-free. But despite this, those that already have it, we have been able to track as many as possible, put them on medication, and make sure they stay healthy.
Right.
We are now addressing other issues that they have. For example, someone may have diabetes and at the same time have HIV. We try to see how we can address those ones. Because when you are suppressing the HIV, if you don't take care of the population, other things will kill them. So you see the opportunity that we are providing, what we call multi-morbid care, looking at different diseases and address the individual holistically in a more robust and comprehensive approach.
All right.
Thank you very much.
Indeed, thank you very much indeed, Dr. Sulaiman Lakoh, and he's Director, Disease Prevention and Control at the Ministry of Health.
Exactly. Thanks for being with us this morning.